Hello and welcome to Mystic Dog Mama, the podcast for soul-led dog mamas, where you'll discover how to best nourish your dog and yourself, mind, body, and soul. I'm your host, Dr. Alexia Meller, a holistic canine nutrition and well-being consultant and the co-creator of the Fetch framework. Along with my incredible colleague, Stacy Renfrey, my aim is to help you feel less overwhelmed and more confident in taking a holistic approach to your dog's health through integrating evidence-based nutrition with spiritual wisdom. I'm so thrilled that you're here with me today. You're really going to enjoy this conversation with my guest, the wonderful Dr. Katie Woodley. Dr. Katie is an integrative holistic veterinarian who's on a mission to make sure pet parents like you have natural pet treatment options, along with empowering you with holistic medicine education that can help your pets thrive naturally. Dr. Katie is arguably, in my opinion at least, the queen of the gut-skin health connection. So I wanted to bring her onto the podcast since so many of you listeners and so many of my clients have expressed that your dogs either have gut issues, skin issues, or a combination of both. Do any of these symptoms sound familiar? Burping, acid reflux, food sensitivities, loose stool, vomiting, eating grass, itching, anal gland problems, chewing at their feet. I know that you'll find this conversation really helpful, so grab a pen and paper to take notes. Dr. Katie and I cover so much, including why just trying to treat symptoms might actually be keeping you stuck, the links between our emotions and our dog's health, and how taking a breath might be the best medicine, why paw chewing could be a sign of gut issues, the benefits of taking targeted approaches to your dog's health, why raw food might not actually be the best for your dog with gut issues, and the power of working with energetics. And Dr. Katie gives one of the best descriptions of the detox component of gut and skin issues that I've heard, and how we might actually be doing it wrong. She also shares helpful tips to help soothe your dog's skin while you're also tackling the gut issues. Now, before we get started, I would like to ask you for a huge favor. If you are enjoying this podcast, it would mean the world to me if you would please consider taking a moment to rate, review, like, and subscribe to the podcast. Not only does this help me know what you're enjoying so that I can keep creating content that you find helpful, but it also tells the algorithm that more people should know about this podcast. And that means we can help even more dogs and their guardians. So thank you in advance for rating and reviewing. I really appreciate it. Okay, on that note, let's go. Dr. Katie Woodley, thank you so much for joining me today. And thanks for your little kitten joining us too.
Yes, you're welcome. And there'll probably be two others floating around, and he's going to probably come in and out. He always joins me. So thanks so much for having me today.
Oh, it's such a pleasure. I was just telling you before we started recording that I put the word out to the listeners to let me know different topics they want to have addressed on the podcast and different guests that they want me to invite on. And you are always in that list of people they want to hear from. So I'm
so
thrilled that
grateful.
you're here. Oh, I'm
Yes,
grateful too.
thank you so much. I'm grateful to be here.
It's wonderful. And I wish it weren't actually the case, but unfortunately, the topics that you cover so much that you really specialize in terms of gut and skin health are I'm not even going to say number one and number two, they're the number one tied issues that I see in practice that I hear from listeners, like, how do I even approach this? And I think there's a lot of confusion and the whole feeling of like I'm trying everything. I've got a supplement graveyard. I'm throwing whatever at the wall, seeing what sticks, and I still don't feel like I'm getting anywhere. So I thought today would be a really great opportunity to talk to you about all this and the link between the gut and the skin and how we start to take with a more like ecosystem approach as you talk about, because I think that's really important to look at the body as an ecosystem, but also you and your pet and your household as an ecosystem and the correlations between that.
Yes, definitely. Like we were saying just before this, it is really sad and it's frustrating because there are so many pets experiencing gut and skin problems. And they're really difficult to watch as a pet parent. Your pet's scratching all night. It's usually like impacting their sleep. They're stressed watching them. They feel like helpless and hopeless that they can't help them,
Mhm.
like stop itching. And then diarrhea, happens, vomiting, acid reflux. They always happen on like weekends, nights, holidays, like to all of us, right? So The thing is what I found to be true is that what keeps people stuck is that we're trying to still treat just symptoms and and we're stuck in this flare state versus asking different questions about why is that symptom there to allow us to go deeper into the root causes that led to the symptom. And the other thing too is that also that mindset shift around what healing truly is, because I always joke Amazon ruined it for us. It's great we have like 1 hour delivery, but we like think that if we give something we should see a result right away. And when we use herbs, food as medicine, like these natural remedies, they're working with the body to shift and adjust and heal and change, and it takes time because we have to remind ourselves that it took time for the body to break and it's going to take time for the body to heal. So this is where when you have a plan and a framework and we better understand the foundations of health, that's when we can trust that healing journey process we go on rather than thinking like, oh, well, Sally used slippery elm and it fixed her dog's diarrhea. Or, Joan used quercetin for her itchy pet and like they stopped itching. But in reality, did they actually heal the problem or did we just like treat that symptom like we brought the like fiery flames down? But there's still like this low grade, like fire burning inside. And all it takes is like the next stressor, like going boarding, or like we get stressed. And, what happens then is our pets feel that. And then they're like, oh my gosh, I don't have enough reserves left over because we had these other things going on. And now what happens is it like fills the bucket and everything's overflowing and we see the symptoms reoccur. So this is where really taking that deeper level approach and asking why is it there and how is everything connected. And I break it down into like 5 pillars of health. I try to make it super simple. So thinking about physical health, thinking about emotional health, thinking about immune health, thinking about gut health and nutrition, and then your environmental health, which is going to include things like toxins that are a lot of times invisible to the eye. So when we start thinking about those things and we become aware of it, then we're able to assess the entire ecosystem because that's the true holistic approach. Holistic does not mean we never use conventional medicine. Holistic means we look at the whole body, whole environment, spiritual, mental, emotional, physical, and how it's all connected. So holistic with a W, right?
Mhm.
So that's how I approach pet care. Because if we just go with like using herbs and supplements to like, and we're just like, treat this, the diarrhea, yes, treating those symptoms is important for quality of life. But if that is the only thing we do and we never take the next step forward, you're going to stay in that constant cycle of those ups and downs and those flare ups, and then new things come up. And that's where that gut skin connection, a lot of times we then see itchiness, and you're like, why do they have allergies now? And that's because the gut, we never fix the gut. And now we have inflammation in the skin because the inflammation and the imbalances are so widespread now. So there's a lot to it, but that's kind of like a general overview of how I look at health. And I'm always asking why, sometimes to an annoying extent, but like, why are we using that? Why is the symptom there? Why is that test result off? Why are they food sensitive? Like food sensitivities are not a root imbalance. They are a symptom of a deeper level of imbalance. So those are really important things. And it's just that we just don't know. Like we're not taught to look at that as a veterinarian. We're taught to treat symptoms. And so we're taught also we need a diagnosis to be able to treat. And so when we take this different type of approach, I don't need a diagnosis to be able to fix a body that's broken.
I love that. And I love the whole holistic with a W because I think too that we tend to in the more holistic space be anti-conventional stuff like anti the
Yes,
drugs, all of that. And I always kind of clarify with clients I'm working with it's the inappropriate and overuse of
correct.
pharmaceuticals. That's the problem. But there are times that you definitely need those sorts of things. And so when you can widen your lens and be open to the various things that are needed to get to the root and support the system, then I think you have a better chance at really
Yeah.
getting to that goal that goal of health. But I love that you brought up your five pillars and that you included some things that often get missed out in our more conventional Western culture, not even medical perspective, but our culture, where we tend to miss out the connection between the spirit, the emotions, the body. We were talking just before we started recording about like the very real feelings of butterflies in your stomach before you've got to get on stage. Like there is that direct connection. We know that our emotions influence. But I also wondered if you could talk a little bit about how our emotions as the pet parent influence the dog, influence our all of our pets.
Yeah. So, I mean, this is where there's always going to be connections between everything. Nothing is disconnected, right? And unfortunately, a lot of specialty services, like they're taught and trained to look at that one system by itself. So, like the brain by itself, the gut by itself, the kidneys by themselves, the skin by themselves, right? So, gastroenterologists, dermatologists. I am so grateful they are around, right? Like their knowledge and expertise is invaluable. We need that. But we also have to keep in mind like the gut brain axis. And we have a ton of research that shows that there's a very strong connection. And so, as you just mentioned, when we were talking about like the butterflies, when, if I get on stage to speak and there's 1,000 people there, I get like, I feel it in my gut because of that gut brain connection. And that connection is connected through one of our biggest nerves in the body called the vagus nerve. And this nerve is also connected and sending nerves and innervation to the gut also. So there's all these branches coming off of it, as it's extending down from the brain, extending all the way down the body, and then it's innervating the gut. So if we're feeling stress and we're sending out all these kind of warning signals where we're stimulating the brain to produce things like cortisol or the stress hormones like adrenaline, norepinephrine, the adrenal glands are also part of that endocrine hormonal axis too. And everything is being stimulated. What can happen is that vagus nerve is not going to work the way that it's supposed to. It is part of the nervous system called the parasympathetic nervous system. This is like the rest and digest phase. This is why, like, taking a breath and smelling your food when you sit down is so important. Like not eating when you're stressed, because you're not going to be getting those normal nerve signals to your gut that are also helping the motility to contract down, to send blood to the pancreas to release digestive enzymes. So everything essentially shuts down because you go into what's called a fight or flight or sympathetic dominant state. That state's really important. It keeps us alive. And it's, we see, it's really good back, our ancestors where they're like hunting and like they see a lion and they're like, oh my gosh, this is not the time to be eating our meal. We need to run. And then you're like, okay, we're out of danger. We can go back to doing what we're supposed to do. And we see beautiful examples of this in nature and even our pets when we watch them. Like when your dog gets up and they shake it out, like they're like resetting their nervous system. And you see this too, like any nature channels. I hate watching them, but I love watching them because usually, you know what I mean? You're like, no, don't get them. But then you're like, the lion needs to eat, right? But you watch like the animals and the like antelope on the African savanna, and they're getting chased. And then they stop, they shake it out, and then they go back to eating right away. You're like, how do they do that? Whereas like humans, we're all like stressed out. Every little thing is triggering everyone. Like every single moment in life has become this like lion attacking us moment. And so our bodies are getting stuck in this sympathetic dominant fight or flight response. And now here's the thing. I prelude this with, you do not cause your pets health issues. However, we share the same ecosystem. We share the same energetic space. Dr. Joe Dispenza displays the research behind this so beautifully. There's lots of research. This is not woo-woo medicine. We can actually show how this works in terms of like heart coherence and the energetic waves that come out. Our pets feel it. We go into heart coherence with them. So if we're out of rhythm, if we are stressed, our pets will feel it. And they can mirror that. They can absorb it. And then what happens if we're constantly stressed? They can become constantly stressed. And then a lot of times what we'll see is over time, because once again, it takes time for the body to get to a point where it can't handle it anymore. And then they're eating their normal food they've been eating their entire life. and now they can't handle it. So you see loose stool, they get like vomiting, you're seeing like kind of the burpiness, they're like retching, they have acid reflux, they're going out and wanting to eat all the grass, or it may not even be digestive issues. It could be they're itching, they're chewing on their feet, they're getting hot spots, they're getting anal gland problems, they're getting ear infections. And so it's so easy to miss that emotional health component. And that emotional health component is directly connected to the gut. We have 70% of the immune system in the gut. So if something is off there with the microbiome, the function, it's getting inflamed, that immune system's going to get triggered. And now we have the inflammation going to the skin and it turns into a hot mess, right? And then you go to the vet and they're like, Apoquel, Cytopoint, steroids, but none of that was it's not gonna fix if that root imbalance was essentially we needed to take a minute to breathe and calm ourselves down and focus on emotional support. Obviously, there's other things we need to do when we get to that place because now we have physical ailments. But however, if we don't ever fix that or become aware of it and start working on it, we're going to get to a state of true ultimate healing.
Absolutely. Oh, thank you for sharing that. And I think it's so true. An analogy is just giving supplements or probiotics or whatever, but still feeding the same food that's the irritant or and so you
Yes.
come off of that stuff and then the issue creeps right back up. So you
Right
have
back.
to get to the heart of it. And I think we so overlook, like you're saying, that the stress and the emotional component of it. We sort of think that doesn't really impact, but in reality it's exactly the same thing. If you're keeping yourself in a stress state, if you're keeping all of the conditions of the environment super stressful for the dog, they're going to have a lot harder time getting to that healed state because they're battling against all those other environmental issues that
Yep.
there's also the element that when I work with different pet parents that have these gut and skin issues and I talk to them about the emotional component, I agree with you 100%. They're not causing the
Yep.
dog's issue. But I try to impress that that's the one thing that you have direct control over
And
in
it's free. And
and
it's
it's
free.
free.
Yes.
Exactly. And in a
But it's
world
the hardest thing to do.
it is the hardest thing to
Yeah.
do. It really is. But
Yeah.
I love that you're coupling it with all of this stuff. I wondered if you could talk a little bit about what actually the kind of gut skin axis is too. So we've talked about the gut brain. What about the relationship? Why do we see a lot of gut issues kind of come out in the skin? What's going on there?
Yeah, so let's bring it back to kind of some of the things that pet parents can think about. Like what are the things that can impact the gut? We talked about obviously emotional stress, but also too, you also touched on it, like the food we're feeding. So when we think about, a lot of pets are being fed processed food diets, those would be kibble. They're processed at high heat temperatures. They produce things that are going to create oxidative stress, inflammation in the body. It's not a species appropriate diet for our pets. I want people to think about it's like if you were to eat Cheerios every single day, every single meal for the rest of your life, you'd be like, my doctor is insane for telling me that, right? It's fortified, it has vitamins and minerals, right? So it's technically fully balanced, but it's very similar to kibble. Now, I don't want to dismiss or shame people for feeding kibble because I like to meet people where they're at, and there's things you can do to help digest kibble better and to use things like superfood toppers to help increase the nutritional content if you're not able to shift over to like a lightly cooked food or a more minimally processed diet. So but we have to be thinking about food because it can create resistance to healing. It can put extra pressure on the gut. Food is also going to manipulate and influence the microbiome. So the microbiome is the trillions of different microorganisms that are living in our gut. That tends to be, we have a lot more species. There's going to be different amounts from the small intestine to the large intestine, but we're going to be feeding the different types of microbes depending on the food we feed, from like carbs, fats, proteins, just to keep it at a super high level. So food will manipulate things at the gut level. The other thing too is the toxins. We live in a toxic world. That is just hands down. We know 90% of the water is contaminated with glyphosate or Roundup. You can't get away from it. But one of the first things I teach is we follow a 5R framework. how can you reduce or remove some of these things? So if we can lessen the burden of what our pet has to process. So, I talked to a client yesterday. She's in Colorado also. We have winter. It's cold. It's like 25 degrees outside right now. Mosquitoes are not alive right now, but yet people are afraid to not give heartworm preventative through the wintertime. There's a time and a place with high risk areas. I'm not against it. I ask, I look at life cycles. How long does the drug last? Use kind of different timeframes for giving that. But the thing is, if you don't need something, don't give it. That's really important because it's still a drug. There's things in there and it's going to put more stress on the body. So reduce or remove. So your toxins are something to look at, your cleaning products, the water we're using, are we filtering water, the laundry detergents, all those things are going to impact the gut. They're also going to impact the skin. So this is where you don't need to make a massive overhaul. We have to keep things simple. As we just talked about, everyone's stressed out. They're already overwhelmed. So pick one thing to do and eliminate that. And maybe just start with one thing a month or whatever feels doable for you that does not elevate like the stress in your body when you think about it. And just go with that. It will make a difference. So really, really important. Told you all the cats will come. And they're all black. So
I love
just
it.
FYI, you won't know who's who, but they're all black. So, looking at toxins is really, really important because the goal is to create a happy and healthy gut with less inflammation, support a healthy microbiome. Now, the thing with the gut and the thing where I see a lot of people get things wrong too is that we just think about the microbiome. But once again, everything's involved in an ecosystem. And so this is where, if we're only thinking about the microbiome, we're missing also too the gut lining, the immune system. So I mentioned earlier, 70% of that immune system's in the gut. So this is where that immune system sitting right there in the gut lining, waiting for anything where it might need to respond to it. So whether it's food, bacteria, toxins, something foreign. And the way that the gut lining is that it's held together very simply. It's a very complex thing, but held together by tight junctions. It's one cell layer thick. That is all that is separating it from your gut lumen, where food and like stool is, from your circulatory system, your blood, like where your immune system is. And then, so what happens is we have these tight junctions holding things together. So those cells should be held nice and tight. Nothing should pass through that shouldn't pass through. So things like bacteria, toxins, and food. Now, what can happen is if we have all these toxin overload, if we're not digesting our food properly, if we have an overgrowth of bad bacteria in the microbiome, or we don't have enough like good bacteria diversity, what can happen is that the gut starts getting inflamed. So then we get inflammation. What will happen is the cells will produce a protein called zonulin. And then what happens is we start getting the tight junctions separating. Now we get these holes and we call that leaky gut. Leaky gut is not a root cause. Leaky gut is a symptom of imbalances, something to keep in mind, because I hear all the time, I use leaky gut protocols and it didn't work. And I'm like, well, do you even know if you have leaky gut? We have some great tests that we can actually identify if we have leaky gut now, which is fantastic. So biomarkers like zonulin in the stool will tell us. Calprotectin is an inflammatory biomarker we can actually measure in the stool. Most pet parents in the US anyways can test for this, which is fantastic because then I have leaky gut, it's inflamed, things are passing through. And now we have that immune system, the little fingers sitting there kind of sensing, waiting. And they're like, ooh, what's that? I don't recognize that. And they're doing exactly what they're supposed to do, where all of a sudden now we're sending white blood cells, we're creating an immune response. And they're like, we need to inactivate that. We need to like increase inflammation so we can bring the mast cells. So they're going to release histamine. And then what happens is because that circulatory system is the next level, all of that immune system response is now going through the body. And where it manifests a lot of times is the skin. And so that's why we see inflammation at the skin level. So that itchy skin, chewing the paws, hot spots, rashes, ear infections, scooting. I mean, anal glands are part of, the GI tract, but that's a big part of it. Mm-hmm. And so what happens then, though, is that most of the time we go for the symptom of the skin versus asking what's going on at the gut that led to the skin inflammation. So there's a lot of different reasons for skin inflammation. So I just want to be specific that, there can be environmental sensitivities. We can have parasites, we can have fleas. Like we need to rule out other causes of itchiness because there are multiple reasons why it can happen. But if you're stuck in this like vicious cycle of like nothing's working, if you haven't looked to the gut yet, we need to do microbiome testing. We need to do some of those biomarker testing for the function of the gut, because that's going to help you actually create a plan, once again, that healing plan that gives you the framework of how to actually heal the body. So then the skin issue can even have a chance of ever going away. You still have to deal with the skin and like secondary infections like bacterial or yeast or ear infections. And that's where like topicals and other things, and sometimes even antibiotics may need to play a part in that role. But we have to go deeper. And that's where that gut skin connection plays a part. That immune system is like the bridge with it. So I view it kind of like, a garden really, where your soil is like your microbiome. And when you think about a garden and when we plant a seed, like, is that plant going to develop into this beautiful, healthy, strong, resilient plant if the soil isn't healthy? Or if we're dumping a bunch of glyphosate or pesticides and herbicides in there, it may work short term over time to keep the weeds out. But what happens is we're turning that soil into dust, and that plant is not going to thrive. It's not going to survive, and it's going to get inflamed. It's kind of like seeing like the mottled like lesions on leaves. And you're like, what is that? What is causing that? And then all of a sudden you have infestation of all the bugs and come in. And so it's just thinking about, okay, well, what creates health? Why do things go off? And how is everything interconnected? And there's a lot there. And I recognize people are probably like, oh my God, I'm so overwhelmed. But once again, taking it back to your foundations, where in physical health are we exercising? Are we engaging with our pets? Are we allowing them to get out in the soil and like get in touch with like the soil microbes and the environment? Your emotional health, how can you just become aware? That is the one thing. All I want for people is just to become aware of the feelings of stress. And then all you have to do is go, there it is. I'm feeling it. Okay, I'm going to just sit with it. I'm going to sit with it. I'm going to let it be, and it's okay, rather than shaming it and guilting it, right? Where a lot of times we feel the stress and we go, oh my God, I'm going to hurt my pet. Like, and we go down this vicious cycle. So just being aware of it, recognizing, very important. And then looking at your environmental health. Okay, I know I'm not using the best like laundry detergent, it has all these smells and things in it. I can do better. Okay, I'm going to finish this bottle because whatever reason, if it's financial, whatever reason it is, the next one I'm going to purchase is going to be something that's free of that stuff. And then, okay, next quarter, I'm going to get like a Berkey water filter or, some other water filter to filter out the water. So it doesn't have to be all these things at once. So I have clients that want to do all the things just because not creates more stress for them. But just becoming aware of these things makes a huge difference. And it allows you to be able to then move forward rather than staying stuck in this like vicious cycle of, I don't know what to do. I don't know where to start. I need to give these supplements. I don't, like that's really, really key at the foundational level. Obviously, we can talk about some of the like things you can do right now that are going to support your pet when there's like gut and skin issues, but we have to take the step back or it will never get like resolved.
Right.
Like you'll only get so far and then it's going to come back, and it usually comes back with a fury. Like I see it over and over, and it might be months, it could be a year, but it evolves into more. Like hands down, it's not a guarantee, but I see it over and over again. And so I really want, as people like listen to this, it's not the easiest work to do, but just really become aware of the things that can potentially impact health because it will play a part with gut and skin health issues.
Thank you so much for all of that. And I agree. I think that it's also remembering that it's a both and situation, that yes, you're treating what you're seeing right now. You want to support the dog, you want to ease those
Yes.
symptoms. And we have to get to the root and do all of the processes that you're saying of asking those different questions and taking a different lens to
Yes.
to how we generally approach health and looking at what are the things that I can control and what is in my control right now, like you were saying, according to my resources, to my time, to my stress levels, what have you, and come up with a plan that is approachable for you, which again, going back to what you were saying of like Sally's dog did well with slippery elm kind of thing. And it's like, but what is right for you and your dog? And that's going to look very different. And
Yep.
not everything is going to work for every single dog. So a lot of this too, in my experience as a consultant, is that it's a lot of trial and error. Like we have to deal with the dog in front of us. And so having that, what I often refer to as a sense of grace with ourselves with this as well,
Yep.
of being self-compassionate and aware that we are doing the best that we can in any given moment,
Yep.
and approach it like that, I think makes it a little bit of an easier task because, to your point, these issues don't disappear overnight. And I think that's the thing to hear over and over again. Like, this is not going to be gone tomorrow. It's just
Yep.
not. The reality is, it's just not. And so, how do you sort of prepare yourself for that, brace yourself for that, and all that's going to come up as a result of
Yeah.
that?
Yes, definitely. And you know, I'm sure you've also seen this too with your clients and patients. Like we can get fast results. We
Hmm.
can.
Hmm.
Like we can help reduce the itchiness, we can help with the inflammation, we can help with diarrhea. There's so many great herbs, topicals, food as medicine, understanding the energetics. And a big thing that helps with that is understanding how the thing works that we're using.
Hmm.
That's really, really important. So, like slippery elm has energetic properties to it. And that's why it's going to give us, I always say to my clients, just because something doesn't work doesn't mean that nothing will work. When we understand why it doesn't work, it shows us a layer of imbalance with your pet. So, everything gives us information. And when you shift to that type of mindset, that empowers you versus like all is lost, nothing's going to work, we lose hope, we feel helpless. But it's a reminder. And you don't have to be an herbalist, you don't have to understand everything at like in-depth content, like all that stuff. Like, I don't want people to take it that way, but just keep in mind. Like just because I do, a lot of Chinese medicine, and Chinese herbs are treating based off of patterns of imbalance. And so just because we're treating diarrhea, it could be like 5 different types of herbal formulas depending on that pet's imbalance. And so if we use an herbal formula and we're like, oh, that didn't work. Like, okay, it actually made things worse. That's a potential.
Hmm.
But the difference here is working with that practitioner who understands how it works. Because if I hear that something made something worse, that's going to tell me that there's another layer there, that herb wasn't treating, or it was too much, or we needed to, get rid of some of the inflammation or the heat first, whatever imbalance that was. So that's really, really important because I find so many people lose hope when they're like, it didn't work. It made them worse. It's like probiotics and prebiotics. Like for one, I always get asked, what probiotic do you use? And I'm like, well, what are we trying to do? Like, not everyone likes that answer, right? And that's okay. I'm not for everyone, but I'm always going to ask that question. Like, we don't just give probiotics to give probiotics. And unfortunately, they're being overused and they can create more imbalances, right? So, this is where if we have something like a small intestinal bacterial overgrowth and we're just putting in a bunch of probiotics, we could actually be adding fuel to the fire. So whenever I used a probiotic and I hear what strains it were, like it was, and I'm like, oh, that gives me information about where your pet's imbalances are. So that's really, really helpful. It doesn't mean that we'll never use probiotics, but it means that we're at this stage of health and it's giving us clues to what we actually need to treat in the first place to then be able to move on to the next step. And it's the same with prebiotics. Prebiotics are the food source for the bacteria in the microbiome. So we need it's like fiber, inulin, fructooligosaccharides, your large arabinogalactin. So things that you'll see on the label that typically are going to be with a probiotic. Like we need to feed the bacteria. They need food. Like that's another big issue with a lot of gut health issues is that a lot of people aren't using any vegetable matter. They're not using any type of fiber. And from all the microbiome research that's been done, we need a food source for the bacteria. Now, here's the kicker that makes things hard is that depending on the microbes in the microbiome, certain imbalances, certain types of bacteria will react differently to different types of fiber. So, say you give something like inulin that's in a probiotic strain, it may not be the probiotics that your pet's reacting to, it could actually be the prebiotic. And so, once again, it's not like, oh my gosh, nothing's ever going to work. My pet doesn't tolerate fiber. It's asking the question of, okay, what type of fiber was that? Okay, what is going on at the microbiome level? Maybe we need to do a microbiome test. So we can do a stool test and look at where are the imbalances? Do we have an E. coli overgrowth that's creating acid reflux? So those are things that I'm constantly looking at whenever I hear a symptom to a supplement is asking what does that supplement do and what does that mean in terms of the body? And that's why also too a lot of pet parents partnering with, an integrative practitioner who understands that is so important. I can't harp on that enough. Doesn't have to be with me. I know not everyone resonates with me, and that's okay. But find someone you can partner with, especially if all of this overwhelms you, because it's having a mentor and a guide to help you figure out what is the path and develop the plan for you versus just trying everything and hoping it works and you have no idea what's working, what's off, things like that too. That's really, really important. So if you're able to, and there's a lot of, pet health coaches, integrative practitioners, a lot of holistic vets do telehealth consults. We have a program set up to help pet parents with gut and skin problems. But having a mentor and a guide is really, really key versus just trying everything and hoping something sticks.
Absolutely. I mean, I talk all the time that really we need to take targeted approaches, but we get to that targeted approach by asking a bunch of different questions and understanding and piecing things together. And, I've had Rita Hogan on the podcast a
Yeah.
couple of times now, and she talks about how disease states actually it stems from improper energetics. So for a
Yep.
cool dog, that's pushing the cool dog into a cold state, and a warm
Yep.
dog pushing them into hot state. So something that's going to be really great for bringing health for a cool dog is actually not going to be the right thing for a warm dog. That's going to push them into disease state. So to your point, if you have somebody that's understanding of those kinds of parameters that we can work with, we can figure out what's going to work right for your dog and take a targeted approach versus just shoving everything down the dog's throat, shoving everything into the bowl and just,
Well, it's expensive too.
it
I mean,
is.
we both use the same term, it's a supplement graveyard. And
Yeah.
I totally get it. I have a supplement graveyard from my journey with like my husband and autoimmune disease. And when we were using that approach, and I was like, this doesn't work. This does not work. Like, it's great now. Like, you can shop from it. Like, I joke about that, right? Like, I have things on hand if we have an emergency. I'm like, cool, just grab that, right? Like, it's great. But Rita's 100% right. Like food therapy and Chinese medicine, and just when we think about everything in general, everything has energy. And so, this, especially relating it back to pets, let's say with gut health issues, a lot of these pets, so from a Chinese medicine perspective, spleen is digestion. So, it's not the organ, it's kind of weird. Just kind of ignore the organ side conventional medicine knowledge. So, spleen is digestion. And essentially, what it's our cooking pot. So we need the heat to actually cook the food. If we don't have enough heat, we're going to have health issues. We're going to see GI issues, and that can manifest into other problems long term. So when we think about food, especially in like the holistic world, oh my gosh, nutrition is such a crazy place in our world, right? Like it's just chaos. And so it's like, my God, I've never met so many like opinions and like really strong opinions, right? But this is where just keeping it super simple. Every pet's an individual, keep that in mind. So what works for, once again, Sally might not work for Bob. And so this is where going back to the energetics, when we have digestive issues, I work with like a lot of inflammatory bowel disease animals. So, autoimmune disease, they have trouble digesting. They try a raw food diet and they're like, it was a disaster. And I'm like, not surprised. Raw food is very cooling energetically. So if we already have like a cooking pot that's cold and it's like, I can't do what I need to do. And now we're dumping a bunch of like sometimes like refrigerator cold food along with cold energetic food, along with like, let's say things like rabbit or, white fish or cooling proteins, we're just like creating a disaster. And so this is, 100% like energy, food therapy, those things are going to matter. So that's where lightly cooking that food can make a world of a difference for that animal. And as pets age too, this is why you're like, they were fine. They ate this food their whole life. And now all of a sudden they don't tolerate raw. And you're like, they're older. Let's add some digestive enzymes, help them break it down. But also, too, let's just energetically warm it up. Let's make sure we're using more neutral or warming proteins. Everyone hates chicken, but chicken is a chi tonic. And so a lot of pets have food sensitivities to chicken because we've been feeding processed foods. We haven't been assessing those foundations. We've created leaky gut. The immune system's overreacted, created antibodies against chicken. So it is a real thing. But if your pet's not sensitive to real food chicken, it can actually be really soothing and helpful for some of those pets. Now, on the flip side with skin, I see all the time, and it's because some of the companies, kibble companies, they have like a lamb oat like skin diet. And I'm like, my God, like can we just give them some food therapy information? Like lamb is really warming energetically. And so when we think about skin issues, usually we're dealing with like the body's on fire. There's all this heat, there's all this inflammation, they're scratching, they're up all night, like, not even going into yin and yang like energy. They're just way too much. There's too much. And so when we're feeding like especially a processed food diet, which is much warmer energetically too, and then it's also lamb and tons of carbs, and then we're turning that into sugar and we're feeding yeast and we're warming the body even more. It might work short term because you changed the diet and they probably had a food sensitivity to what you were feeding. And that's why you saw like a slight resolution of the symptoms. But then over time, you're like, oh my God, they're getting worse again. And it's like even more like worse. And that's because of that food therapy, the energetics. It's so powerful. And then it's the same with Western herbs. It's the same with Chinese herbs. So that's the power of understanding why you're using something and how it works in relation to that individual patient. Very, very important for getting the results. And once again, the time frame. Like, having the faith, having a path, having a plan, having the support to guide you through that, because it can be scary if things aren't working. Because some things I know that I use are working internally on imbalances. And, I always do my best to educate, like, this is going to take time. This is a long-term supplement. We're going to have to use this for this period of time. Obviously, we're going to be talking all the time and you're going to be letting me know how your pet's doing. So if I feel like we need to adjust something based on the information you're giving me, we will. But some of these things, they just take time to like repair the damage that's been done, because when that immune system gets stuck in that inflammatory state, it is really hard to break sometimes, especially if we have years of health issues. So that's something to keep in mind too, but 100% energetics of things, like very powerful.
Oh yeah,
That's the reason why I love I say holistic medicine. I hate saying holistic medicine because I, with a W, because I think a lot of times, like we said at the beginning, like we tend to think you never need drugs, like all those things, but it's really looking at the body as a whole and how things are meant to work with the body in those imbalances present.
I agree with you. And actually, Chinese medicine, I'm not an expert in it by any means, but even just coming to a better understanding of warming and cooling and understanding the meridians and the body
Mm,
clock and all of that has just it's
yes.
provided so much insight that's been so helpful for me to be able to see where patterns are developing with client dogs, or even the link between behaviors that seem like they're going to the behaviorist about the behavior, and I'm like, that's a liver imbalance that's happening every day between 11 p.m. and 1 a.m. I think we,
I know. I
you're
love
like,
that, right?
it's
You're like, oh, you're a wood personality. Okay,
yeah.
cool.
It's
I
just
know.
magic. It's total magic. But something I wanted to ask you about too, because I've heard you speak about this so well before, and that's the detox component when we're
Mm,
starting to think about the gut and the skin as well, of how we actually get things out. And actually, this links to wood and liver, and how do we support detox? So, would you mind touching a bit on what that looks like?
yes, detox. Here's my first disclaimer because everyone's like detox, and we're like getting to the new year. I'm not sure when this like will be out, but like, everyone's like, "Oh, I have my like detox, like dry January, right? Like time for detox." And you're like, no, we're literally detoxing every second of every day. Like that's the thing. And we're also being exposed to toxins every second of every day. Like our cells are getting rid of, debris, they're getting rid of toxins just through normal metabolic pathways. And so detoxification is really, really important, but most people do it wrong. And what happens is, especially when we're dealing with like gut health issues, skin health issues, is that we go for this strong detox and we're not supporting the pathways in a specific manner. And we end up pushing out all these toxins or getting toxins backed up. And what happens is we end up in a Herxheimer or a detox reaction. And I hear it all the time. And they're like, oh, it's normal. Like it means that it's working. And I'm like, no, we shouldn't have that. We might get a little bit. A little bit's okay. I'm fine with that. And sometimes you can have, I don't want to see health crises happen. Like sometimes you'll have reversion as you're healing things, and depending on the different modalities you're using. However, we should never be in a place where that pet is so sick or their like skin is like bleeding. That should not be happening. So this is where detoxification is very closely connected to the gut. It's also connected to the skin, right? If things are backing up and the body is becoming more and more inflamed, we can see it manifest in the skin. It's got to go somewhere. The skin is a detox organ. And so this is where thinking about, well, what are the detox pathways, right? We have the elimination part, which is going to be the gut and the kidneys. That part is really, really key because if that's not working, say, even diarrhea can be a problem or things are moving too fast. Constipation, huge issue. Because when we think about constipation and the stool's not moving out of the body, the stool has a lot of toxins that are being dumped into it from the liver, so through the gallbladder into the bile into the small large intestine. And if it's not moving along, what can actually happen is there's a process called enterohepatic recirculation. All that you need to remember from that is that the toxins will go through a portal vein from the gut back into the liver, and it'll have to be reprocessed. So we will recirculate toxins if we're not getting them out properly. This is a big reason why I use binders. So binders are things like activated charcoal, RX clay, bentonite clay. Those are a couple examples because what they're going to do is they're going to bind those toxins and not be allowed to be resorbed, and then you poop it out. So really, really key. Also to kidneys. So when I'm working with a pet that also has kidney disease, we know that detox pathway is not working well. That's why we see BUN creatinine increase. Those are waste products. And that's why we see that on blood work. And if it rises, our pets don't feel good because those waste products are building up. So making sure that we're supporting blood flow to the kidneys, that they're working properly, they're filtering out using things like dandelion, really, really helpful. Dandelion leaves are really helpful for diuretics, things like that. So I'm always focusing on and asking first, elimination, how well is it working? The other thing, before we even get to the liver, I want to be asking is what is the diet? So the mineral nutrient status is essential before you even think about detoxing your pet. If your pet is not digesting and absorbing the food and they're on an unbalanced diet, we're going to have problems. The reason why is that there are two phases of detox in the liver, and they require different vitamins and minerals and nutrients. And what can happen is we're not supporting phase one or phase two. They're not going to work well, and toxins can get stuck. And then they get recirculated, they get stored in the body. And that's when we see things like flare ups. So if we're pushing like detox, say like we're just using milk thistle and we're majorly supporting the first phase of detox, that's actually turning toxins into more toxic compounds in that first phase. And we don't have enough nutrients to support phase two, the liver's going to go, oh boy, it gets inflamed. One of the things I see on blood work are elevated liver values. So that's a key. Whenever I see that, I'm like, oh, detox not working well. So that's always like, that is a check engine light. that detox is not working well, and there's things that we need to adjust, looking at digestion, looking at elimination, and then thinking about the nutrients for phase 1 and phase 2. So keeping in mind, okay, optimizing diet, breaking down the food. I use a lot of digestive enzymes because I feel like animals are suffering there. Just like people, as we age, we lose the ability to digest our food. Supporting them to break down proteins, fats, and carbs is important. So getting that in order first and helping them there. And then looking at, okay, now what do we support? Phase 1, phase 2, these are things like B vitamins, really essential. Test the B vitamins, see where your pet's at, see where vitamin D is at, see where your omegas are at. These are all beautiful tests that we now have access to where you can get an idea of how well is my pet doing in this area. If you can't, do those tests, then keep that in mind and we can use supplementation. So supporting those areas, and then also to thinking about the gallbladder and bile. Bile is really, really important. And bile is a huge problem for so many pets and people. So this is really important because what happens is bile is going to help carry those toxins out, dump it into the bowel for it to be excreted. Bile is also a detergent. It is breaking up fats. So, I mean, you've probably heard it so many times. My pet doesn't tolerate fats. I'm like, we have a liver and gallbladder issue. We have a bile problem. So this is where using things that are like bitters to help with that excretion of the bile, to help thin the bile and help contract down the gallbladder to get the bile out is really, really important. That way it can get into the bowel and then it can also work with the microbiome. So things I use a lot of like cooked beetroots. Those are really important because they're really rich in betaine and they help thin the bile and it's easy to do. Just cook some beetroots, get some beetroots, have some for yourself. It'll help your bile also. Lots of great rich nutrients, rich in nitrates, things like that. So using things like that, but thinking once again, where do I start? I start at the end, the elimination phases, make sure that those are working well. I start at the beginning, making sure digestion and that first part of the stomach is working well. And then I move to phase 1, usually phase 2, and then phase 1 of the detox pathways in the liver, because we need phase 2 working well, or things are going to get recirculated and stored and build up, and it's going to push toxins out. So a big cue of like that I see with a lot of pets, if they're experiencing like they eat and then they get super itchy, and this is the same with people, is that phase 1's not working well. Because you're eating, the body's processing stuff, and then you're getting really inflamed and it can't handle it. And what it does is it kicks that inflammation back out into the blood. All that excess histamine gets released, and that's where you get itchier. So those are key ideas of like, whoa, this is like a bile, gallbladder, liver issue if you're seeing things like that. Obviously, I'm also thinking about leaky gut, food sensitivities, and why is that there? But supporting those areas of digestion first is really, really key.
Oh, that's amazing. Thank you for that. And so if we're to leave pet parents, I think that's a brilliant idea of like how you can be adding in the bitters, et cetera, and supporting the multiple phases of elimination through that. How do then people deal with the topical stuff that they're seeing on the skin at the same time? And I think one of the most common things I see, I'm assuming you see this all the time too, yeast. That's like the top skin issue. And I think there's a lot of concern with, so how do I also deal with that on the skin? Do you have some advice for people with that?
Yes. And biggest thing I'm going to say, it's probably not going to go over very well, but I'm going to say it, is make sure you go to the vet and get diagnostics done. Really important, because I feel like so many people assume there's like yeast and there could be some other things going on. And this is where knowing what you're treating is going to help you in the long run. So I know a lot of people are like, I don't trust my vet. I don't want to go to the vet. This is conventional knowledge. Skin scrapes, tape preps, looking under the microscope to see, do we have bacteria? Do we have yeast? If we don't see that, there could be like skin cancers. There's other things that it can be less common. That can be autoimmune diseases, things like, discoid lupus. It could be a zinc responsive dermatosis. There's a lot of things that can cause this like skin problems on the outside. So go to the vet, get diagnostics done so you actually know what you're treating. Now, topicals are very important. Once again, we got to heal the inside. That's going to take time, but we got to support the pet too and the symptoms that they're seeing. So this is where topical treatments, shampoos are really important. So this is where shampooing once a week when we have a lot of skin issues is really important. I love four-leggers. I'm going to throw a brand out there. Um, using shampoos that don't have a lot of artificial ingredients in them and have soothing properties, soothing herbs included in them can be very beneficial. Now, obviously, you can create your own shampoos, but there's a lot of really poor quality shampoos on the market, so you want to be careful what you're using. Now, the medicated shampoos from the vet can work. So don't get me wrong, they can have other chemicals in them, but they can work. So use that if that's all you have, please. Like we've got to do the bathing. The other thing too is most pets are having feet issues too. Foot baths are essential. Even if it's only for like 30 seconds, that's better than nothing.
Mhm.
So dilute betadine or using Epsom salt baths, or even I like essential oils. I know that's probably a whole nother topic that we would probably talk about because it's very controversial. Brand and dosage are very important for essential oils. So keep that in mind for everyone here. You don't want to walk into your supermarket and buy an essential oil. Do not do that. It's poor quality. That's where things go wrong and why essential oils have a bad rap. But this is where using things in the like water bath that are antifungal, that are antibacterial to really help clear. So even green tea, I use chamomile, very soothing. Get your pet to stand in it for as long as you can. If you can get them to 30 minutes, fantastic. Put something like a licky mat on the wall and let them just like lick to their heart's desire while they're standing there. And then dry off their feet. You don't need to rinse it. And then this is where topical. So this can be on the feet. It can be on like red infected skin. I use a lot of colloidal silver for its natural antibacterial properties. I combine it with teas. I use a lot of teas. So chamomile tea or green tea, black tea is also very drying if you have moist lesions and sores. So we want to like spray that, let it dry. And then I use a lot of calendula oil. So calendula oil is very soothing. It also heals mucous membranes and skin. So that can be very, very powerful to apply then topically. Aloe vera gel is also very soothing. Aloe vera is cooling, so it's going to take the heat out. And then make sure that you do something with your pet so that they don't just like lick it right off. So do something, play with them. If you want to feed them, go for a walk, do something with them to allow like the 10 minutes so that it can absorb. But those are kind of some of the basic things, the routine things that I start with to try to really help bring down that fire, that inflammation, and then also for the like antibacterial, antifungal properties too. Because we have a lot of great options. Like we don't necessarily need to go to, antifungals, antibacterials. Sometimes we do, depending on the severity of what's happening. Like when we are just like kind of past past the point of no return, which sometimes happens. I don't want to say no return, but no return for like conventional meds. Sometimes we do need to use short courses of things to calm things down. So this is where like a short course of low dose steroids may be necessary. Obviously, there are like Chinese herbs and other things that I would use with my own clients if I'm managing their care that can act in a similar manner. But don't be afraid to use things if you need to calm it down so the natural stuff can work. That's really, really important also. Sometimes we need something that works quickly, and conventional meds do, and you calm it down, and then your other stuff is going to work, and then you continue that long term.
Thank you for raising that because again, it goes to the point that the problem with these conventional drugs is like the long-term overuse. It's not that
Yes.
they shouldn't ever be used. They have a time and a place. And if it's a time and place for your dog, talk to your vet about that. Absolutely.
Yeah,
Absolutely.
100%. And here's the other thing too. I see a lot of my veterinary colleagues using things like Cytopoint injections, like first off. I prefer personally, so this is just my personal experience and opinion, so take it for what it's worth. I would rather use oral steroids for a short period of time that I can control the dosage of and the length of. Because the other thing is too, is if we give an injection, so whether even like steroid injections, I'm not a fan because what happens is we can't take it away. We don't know how long it's going to last. If it creates a side effect, I can't stop it. We just have to run the course and try to manage the side effects. And it's the same with Cytopoint. Some pets last for like 3 months, some last for 6 months, some last for 3 days. And the problem is too, is that I can't tell if what I'm using is working. So that's the other thing. With steroids, at least I can use the most minimal dose to calm down the inflammation. And if we have a little bit of itchiness, that's okay because it'll show me that the stuff that I'm using is actually working and that pet is comfortable. It puts the pet parent in a much easier state. And then it gives us an idea too. They're like, it gives them like relief. They're like, oh, I added that and they're like not itching anymore. I'm like, fantastic. Okay, stay the course. And then I'm going to have you lower the dose of the steroid and let me know what that does. So I really like being able to be in control of like the drugs and like the herbs and the things that we're using so we know what's working.
Oh, that's perfect. Perfect. Thank you so much. There's just so much we could talk about with this. Would you be open to coming back for another time? Is there?
100%,
Oh,
100%.
awesome.
I know we just like
Awesome.
grazed the surface and
I
probably opened
know.
a bunch of can of worms.
Which is great. So listeners, if you have more questions for Dr. Katie off of the back of this, please write in and we'll just set up another time to chat and we'll ask those questions. That would be wonderful because like I said, this literally every single dog that comes to me, there's some to some degree, some level,
Yes.
there are gut and skin issues. And to your point, we are facing them as well. So it's a topic that we need to talk loads about. I wanted to ask you though, where if listeners want to work with you, they want to find out more about your offerings, you
Sure.
have a beautiful program. Can you tell us a little bit about that and where they can find out more information?
Yeah, 100%. So I made it super easy. If you want to find more information, just go to thenaturalpetdoctor.com. It's also my Instagram handle, it's also my Facebook page, and it's also my YouTube channel. So we have a lot of free content, blogs, YouTube videos that we release every single week. I also have a free gut health guide and a free gut health masterclass that goes deeper into those foundations that we were talking about. So I highly recommend watching it. It is long and I don't apologize for it. There's a lot of information there. So
It's
you
good.
can rewatch it, you can take notes, you can go back to it. But definitely start there. And then the way that I work with pet parents is a little bit different. So I actually have a lifetime support program called the Healthy Holistic Pet for Life Blueprint. And this is where it is an application program because I want to make sure that it is the best fit for what you need. And so this is where if your pet is dealing with any gut or skin health issues, that's what I support in that program specifically. So you can go to my website. There's a spot for the application you can always reach out to and let us know if you have questions. But I do free discovery calls. So that way I can hear your story, your challenges, what your goals are, and then we can see if partnering together works. But we start with testing in that program because my big thing is we have to uncover those root imbalances, as you heard me touch on a little bit today. And that way we have a much better idea of where to go. And then being able to create a personalized action plan for pets is key so that you have guidance on why are we using these things? What does it do for the body? And what do I need to do to follow this? How long do I use these things? So it's all laid out for you so it removes that stress. And then, of course, we have a community that I moderate. So that way you have really fast, easy access to myself whenever you need it. We do live weekly calls. There's a comprehensive training platform that once again goes deeper into how everything's interconnected and some other topics, things like dentals, heartworm disease, flea and tick products, anesthetic procedures, all the questions that every pet parent will have at some point in their pet's life. So that way you feel really empowered and educated and confident when you go into your vet. So if anyone's interested, just reach out, schedule a call. And we'll see if it's the best fit for you. If it's not, I'll be totally honest with you. And we'll figure out whatever's best. But start with like the free content too, because there's a lot there to take in first. And a lot can actually help probably heal a lot of health problems too if you follow those step by step.
Definitely. I can speak from personal experience. Your free content is just amazing. And I love that your masterclass is really long and in depth. I agree. Don't apologize for it. It's fantastic.
Some people are like, what? I think it's like 2 hours. So
I love it.
it's okay.
When I first saw the length, I was like, oh yes, one of my people. Like,
You're my people.
yeah, exactly.
That's
Exactly.
awesome. I love it.
Oh, so good. But I'll leave all those links in the show notes so you can connect with Dr. Katie directly from there. I have one final question for you, if that's
Yes.
okay. And this is a question that I ask all of my guests, and that is, what do you feel like? I know you've got cats, but you could speak about cats or dogs. What do you feel like they have taught you about what it means to be human?
Oh, I love that. That goes back to my soul dog Finn. He's a big reason why I do what I do today. I lost him a few years ago at the start of COVID to a brain tumor, and what he really taught me was that to slow down and be present and to just really enjoy the journey. It's not always easy, but there's lessons in everything. And he really shared that with us. And yeah, he still is he's still with me spiritually. Um, but yeah, I'm looking at him right now. He's on my wall, a picture of him. So um, yeah, he's just a blessing. And it carries through with my cats. Slow down, be present, be grateful. There's so many blessings around us, even through difficult times.
I love that. Thank you for sharing that.
Yeah, of
Dr.
course.
Katie, this has just been so wonderful. Thank you for your time, your wisdom, your energy, just your lovely spirit being here with us. I'm really grateful.
Oh, thanks so much for having me. It's such a pleasure, and I appreciate all the pet parents who are listening and doing the best that they can and wanting to learn and grow. Like it truly means the world to me, like what you do, Alexia, to share this, and also all the pet parents out there who are part of our community and part of our mission.
Wonderful. Like I said, we'll have to have you back.
Sounds good.
All
Sounds
right.
good.
Take
All right,
care.
thank you.
Thank you so much for listening to my conversation with Dr. Katie Woodley today. I hope you found this helpful if your dog is struggling with gut or skin issues. Let me know any aha moments you had. Leave a comment or DM me on Instagram at Mystic Dog Mama. If you would like to learn more about Dr. Katie's Blueprint membership or you'd like to connect with her, please visit her website, thenaturalpetdoctor.com. You can also find Dr. Katie on social media at The Natural Pet Doctor. I've left all this information in the show notes. Dr. Katie and I talked about the importance of feeding your dog to support their energetics. If you aren't sure if you have a warm dog or a cool dog, or you're not sure about what the best foods are to feed them energetically, then grab your free copy of the Fetch Guide to Decoding Your Dog's Energetic Pawprint, where we help you figure it all out. You can get your free copy by DMing me energetics at Mystic Dog Mama on Instagram, or you can click the link in the show notes. And then come back and let me know what you discovered. Okay, until next time.